gentlemen, welcome to Global Health. We're so honored to host this show at NTR TV, broadcasting to more than 900 million viewers across more than 40 countries. This is your TV channel where we are very excited to bring you people from all walks of life, amazing physician leaders as well as people who are touching the health outcomes around globe will be our hosts. And today I have an amazing guest, an amazing plastic surgeon who got out of his surgery and was very kind to join us, Professor Dr. Furkan Karabekmez. He's one of the top plastic surgeons in the world, trained in Turkey and United States and practiced in Turkey and globally, including Saudi Arabia. He has an amazing personality as well. Furkan, welcome to Global Health.
Thank you very much. It's my pleasure to be guest you again.
Thank you. You know, the viewers are so excited to listen to you. They were very curious about the plastic surgeries you're doing, including different types of programs you're doing. And we received so many calls and messages. That's why we decided to invite you again. I know you're very busy and you came just out of the surgery and joined us. Thank you for that.
Thank you very much. It's my pleasure again to be your guest.
Thank you.
I hope it's going to be very great program.
It will be wonderful, I'm sure. You know, just for our viewers, can you tell a little bit about who Furkan Karabekmez is?
Okay. I'm Dr. Furkan Karabekmez. I'm a plastic surgeon. I'm working as a plastic surgery professor in Ankara Medical University. And also I have private practice in Ankara. I graduated in medical school in 1999. About more than 25 years. I worked in Turkey, in Germany, and United States and Saudi Arabia. And also I worked in some missions in Sudan and other cities.
North Africa as well.
Yes.
Beautiful.
It's a great pleasure to hear.
Thank you for being with us. You know, we will talk a little bit more about the plastic surgeries you're doing, you know, and also the innovation in plastic surgery, and also the technology that's being used. What type of surgeries do you usually do? Let's start with that. What are the type of countries that are coming to you?
Yes.
And then the type of surgeries you do for those countries?
Yes, generally we have guests from the European countries. There's certain companies that bring the patients. Also, some patients directly reaching us through our Instagram page. And the European countries is generally Germany, and Belgium and Poland, and this country is, I guess.
So they fly to Ankara and get surgery done.
It's depend of the which country and which cities have direct flight to Ankara. They usually choose. They decide to come here because they don't want any connected flights.
Sure.
And also we have some African patients. Then African patients also not only the cosmetic patients, also have some. Tumor patients, melanoma patients,
cancer patients.
Yeah, this some because of some skin cancer treatments is required plastic surgery, especially melanoma.
Sure.
Some of the reconstruction patients also they seek for our treatments. I had some patients from Somalia. And they had facial nerve paralysis. They required some plastic surgery treatment to reanimation, static reanimation of the facial paralysis. And I guess both cosmetic and reconstructive patients we have from the European and African countries.
Very nice. And from Africa, which countries usually came? Do you know, like, do you have any patients from Nigeria or mostly from North Africa, like Tunisia, Morocco, or Egypt, or Libya? Or
generally, the patients that so far Sudan, Somalia, and some patients Togo, and
Togo.
I connect from Ghana, and is very diverse.
We are very much watching Ghana as well.
Diverse patient group, and also not African, but in Saudi Arabia, I had some patients because of I work in that. They want to come to here, and also some patients reach us through the students in Ankara. Ankara has a lot of students.
Right, international students.
A lot of African students. They have connection. They find me and they bring their relatives or the people they know. They stay their home and they come to me. And if somebody is living from their relatives or people that know, it's more secure.
Of course.
To make connection before and then talk with doctors.
Sure.
It's a very important point for the patients from abroad. I advise the patient, they generally make sure you contact with the doctors.
Of course.
Make sure they know the name of the doctors. And even though you can learn a lot of things from the nurse or assistant, you have to make at least one communication with chatting through the WhatsApp or something, or at least one phone call.
Sure.
To hear the doctor's voice and tell what do you need. And we can communicate with English,
of
but
course.
we have a lot of translators in French and Russian, and we have patients.
So you're multilingual. Any language can join. And
they can come. Some patients will ask to find the accommodation together. We can arrange the transport and accommodation together if the patient prefers.
Nice.
If the patient has some relative in Ankara, we can arrange only hospital.
Of course, of course. And I want to also talk about the latest advancement. You're someone that is following innovation and technology, and especially in plastic surgery technologies, in the preparation of the patient before, in making the decision to do the surgery, using maybe reconstructive imaging, as well as during the surgery. Are there any developments, are there any advancements or utilization of artificial intelligence like that? I'm very curious.
Yes, and like AI technologies is improving in all fields, also in the plastic surgery field. We have many programs, and I am using one of them. For example, the patient has no breast. They're seeking for surgery, and it's very difficult to decide the size of the breast because there is no breast or very small breast, and you need to put some implants. Implant size is very different. There's different projection, different weight and height. And we are using the AI technology for bringing the picture of the patient, making 3D animation of the patient, and you can put the different brands specific size of the breast and then compare it with the patient and see her body how it's going. They can use the augmented reality glass, or they can use the ordinary skin to see. So
you use metaverse in the augmented reality as well as a glass.
Reality glass, you can see there's a mirror. You can look the mirror and see your body as if it's improved with implants.
Wow.
And also for rhinoplasty, we can use this AI technology where 3 or 5 pictures we use to reconstruct the picture and make this small change, then see which change is suitable for faces, which change is natural in their face. Because sometimes they show another person's pictures, and I want this one. It's not natural.
Because it looks better on that person, not on you.
Yeah, it's because
it may look horrible on you,
it's supposed to be proportional. And everybody's face has physiologic asymmetries also. And that's why using the exact person's face for the animation is you get the best result. And
you said proportionality and looking natural. It is important, and using technology to catch that proportionality and natural outlook is also important.
We have some programs, and sometimes we use to show patients, for example, and when you take the best Hollywood artist picture and flip the one side to other side,
it looks better or worse.
No, worse. Again, the worst, because sometimes we have different space between the eyes and nose in the both sides. There's a physiologic asymmetry you cannot see if you didn't see very quite close. But when you make symmetrical, exact symmetry, you see always this strange view. We call that physiologic asymmetry. The natural asymmetry is harmonic asymmetry.
Wow.
And you don't have to remove all asymmetries. Just try to make symmetric as much as you can. And in the program, it also helped this in this way, because it's copying the face with asymmetries, with deformities, and normal asymmetries also. And we can change and show the patient as better, but it's not promised for the result. But just give the idea to the patient and give the idea to us. Beautiful. How can we manage this patient's expectation.
That's amazing. So in terms of the utilization of software, utilization of augmented reality and virtual reality, clearly there are huge developments. Did the devices change over years, or the surgery tools? Are there any developments in any of these tools?
Constantly a lot of devices developing, but we are and not just jumping into the new device.
Sure.
Generally, we are waiting to see long-term results, and we are following the other surgeons to make sure this device is not like a fashion.
Sure.
It's staying consistently with the time. For example, I guess the ultrasonic liposuction device. When you remove the fat tissue from the body, and generally it's ordinary liposuction device using a negative pressure, but
Sure.
the ultrasonic wave liposuction device using for example, the gynecomastia, that means the male breast,
Sure.
a very hard breast tissue. When you try to remove that, the ordinary liposuction might be a little bit difficult.
Sure.
And the ultrasonic wave in the tip of the liposuction cannula gives some sound wave to explode the fat tissue,
Sure.
and after that you can suction easily.
Easier.
In previously there was laser liposuction, but generally nowadays it's mostly abandoned because it was like in the first of all laser is technology, but it doesn't mean its technology is going to better, and that's why mostly we are not using laser liposuction, but the ultrasonic liposuction is still using. Now the last development also the power assisted liposuction. That means generally we use our hands and shoulder is very
Sure.
tight.
Sure.
Now that the power assisted means has some rotatory part in here in the handpiece, and when you put this cannula to suction of the fat tissue, the tip is going to make vibration, micro vibration, and collect the fat tissue without damaging the nerves and vessels.
Amazing.
It's very common. I'm using also, and also there are a lot of things that using for the skin rejuvenation. There is also the results. Some of the results is good. Some results are not objectively shown that it's good. We are waiting and watching, and then applying.
Following the developments and then look at
Because-
science
Yes.
and see the applications.
Because in the past we have a lot of things that seems very, very nice. The commercials was very good, but after that,
Comes and goes.
yeah, comes and goes. But some devices stay.
That's good.
Some liposuction devices, a good example.
They say Turkish surgeons are very talented. Is that correct? Like especially the plastic surgeons and general surgeons.
Yeah.
There is an understanding and realization of that around the globe.
Yeah, generally, not all surgeons and general surgeons, all medical fields. We have very talented medical personnel, especially physicians, because in the selection process in Turkey is very strict,
Rigorous.
rigorous selection, and very, very top people in the students, they choose medicine.
Yes.
That's why we have very high quality doctors. And another reason, in our hospitals, we have a lot of many patients, and
You see variety of patients,
yeah,
all types of
too many
patients.
patients. And in Turkey, a regular hospital, one physician see maybe 40 patients, 50 patients, sometimes 100 patients in one day. And they try too hard to see as many patients. And the training period, the residence period, the resident, before they finish their residency, even though internal medicine, surgery, orthopedics, doesn't matter, they see a lot of cases. When I was in Mayo Clinic, the residents in the Mayo Clinic plastic surgery, they are talented also, but they can't see as much as patients as we see before we finish the residency. That's the problem. They have a lot of education opportunity, but they don't have enough working environment. And that's another things. And that's why in a lot of society, Plastic Surgery International Society, European Society, I'm a member of European Plastic Surgery Society. When I see someone else, they saw Turkish doctors, very talented. They see the presentations, they have seen the. That's why in the United States, they know the Turkish people is very hardworking and talented and has experience in the surgery. And also in Saudi Arabia, even though in the Turkish physicians doesn't go abroad too much.
Sure.
Just missions they go, and or education, or international meeting. For working is nearly started the new last 1 or 2 years because some language barrier, and they didn't need to till now. Nowadays they start to go, and then when I go to Saudi Arabia, they arranging the income of the doctors according to which country they came, and they put ours like Canadian doctors or European doctors, American doctors, and the Turkish doctors with this similar level of salary.
Very nice.
They know the Turkish. And also when I did enter the oral examination for getting the license to
Yes.
work with that, and when I saw that these doctors from, they also admit that, and they have a respect to Turkish plastic surgery.
This is great.
And it's very good research of us, and hopefully we are going to make these programs to make stronger connections.
Absolutely.
With these African countries also.
Of course. I mean, we're here to support our African patients and really provide them the best treatments and best solutions. And Turkey is one of the best countries for that. So you're all welcome to Turkey, and also come to Professor Dr. Furkan Karabekmez to receive the best treatment and proper treatment. I'm also very curious about some of the misconceptions. You know, I want to learn from you, from your perspective, what are the biggest misconceptions about plastic and aesthetic surgery?
Yeah, it's a very common things that people doesn't know what plastic surgeons do exactly.
Yeah.
They do just the celebrities operations and cosmetic surgery. And every field has, every specialty has a big textbooks, and we have many famous textbooks, big textbooks. For example, one of them is 8 different books, 8 big books consisting total, covering total plastic surgery topics. And only one of these 8 books is related to cosmetic surgery, which means the titles of our field, one of the 8 is related to cosmetic surgery. 7 of the 8 is related to other topics in plastic surgery. And that's why even some doctors, when they start residency, they shocked what kind of patients we have. 90% is not cosmetic surgery.
Yes.
We have pressure surgery, construction, facial trauma, repair and amputated fingers, replantations, burn, a lot of burn patients, burn reconstruction, burn treatments, and tendon laceration. Every night we have some tendon laceration come, and nerve entrapments. And in the past, I guess, all the topics staying out of the other specialties left for plastic surgeons.
I see.
In the ER, for example, this compartment syndrome, we opened this compartments. And many patients, the patient doesn't know this because when they need in diabetic foot, when they need, they say, oh, plastic surgery? Is it the place where I have to go? Oh, very strange. They come to us to treat diabetic foods.
You're right.
But they doesn't know that surgeons do that.
So that they only focus on aesthetic and don't realize plastic part, which is very crucial.
Yeah,
It's very interesting that you said. The other ones that don't want to touch, they give it to us. So,
yes.
So you have also very challenging cases, I believe.
Yes. As there is a defect, for any tumor resection, the patient comes to you. They found you, and close this defect, big defect.
Yeah.
Either you can remove this, sometimes another specialty remove. For example, in the newborns, may have some meningomyocele, which means some defect in the back.
Yes.
The neurosurgeons close the dural, the brain levels, and the skin, there is a big defect. They put you in the newborn patient,
and now you have to figure out.
In the back, very big. You have to make very big 3-4 flaps together. You have to draw them, make mathematics and some elasticity. Make calculations.
So mathematics is also important.
Yes,
we
have Z-plasty, for example. The other surgeon doesn't understand what is the meaning of the Z-plasty. When some contractor means when a finger is after trauma couldn't open because there is a tightening in here. You have to make a line here and make 60 degree here, 60 degree here, and cut and
it.
open, stitch. And they said, what happened in here? Because some small mathematics to do this contraction opening. It's also plastic surgery field.
It's a miracle. I'm very impressed with the amazing work you do. You explain so many beautiful points and differentiated plastic from aesthetic, and also the recent innovations. And all the countries that are coming to you, clearly you're an amazing physician.
Thank you very much.
I will close this show. Before closing the show, do you have any messages to our viewers watching us from Africa?
Yes, and the patients from abroad, they can seek the surgery, not only the cosmetic, also the reconstructive cases. they can choose to come to Turkey. And we have some, the Ministry of Health has some common hospitals in some countries.
Yes.
I guess they also may use this hospital to
Beautiful.
get what they need.
Thank you very much,
You're
Furkan Bey.
welcome.
Such an honor having you in this show. Ladies and gentlemen, we had Professor Dr. Furkan Karabekmez, who is one of the top plastic and aesthetic surgeon in Turkey. And if you have any issues, please contact to this number. We'll be happy to have you contact him and also make sure you get the best treatment in Ankara. This is Dr. Yavuz Selim Sılay. We end again this Global Health episode with you. We're looking forward to amazing shows and we will continue to connect you through Global Health. Take care and all the best. Bye.